Hi, good morning Ruben. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of July 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Ruben Felix.
And what is your candidate number, please?
My candidate number is 260342113.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you practice self-care?
The job of a nurse is very challenging. Along with the emotional pressure, there may be some other issues such as job timing, night shift, etc. So, we have to be fit and fine for this job to be available all the time. That's why I exercise and meditate daily. Along with this, I have some stress-busting hobbies such as gardening and cooking. These all help me a lot.
Why are you the best candidate for nursing job?
I have got several factors to address the question. In my previous job, I led a team that was asked to manage the hospital emergency department during the COVID-19 pandemic. We cut inventory costs by 10%, while not compromising any patient care, and actually increased the patient satisfaction. As a nurse, my main motto is patient care. So, maintaining standards is the utmost priority.
What do you think about effective patient and family education?
Effective patient education is needed to satisfy the patients and their families. Every patient has their own learning style. So, we have to understand their learning style and adapt accordingly. For example, some patients want to read the complete medical instructions, detailed information. On the other hand, some just want the necessary information. So, we have to figure out what each patient needs. It is very important to include the family in the treatment process, because they are the main caretakers for the patient in the future. Hence, it is our duty to explain to them all the process, and tell them how they can help the patient.
Have you faced a situation where you were under a lot of pressure?
In my previous job, I worked as an ICU nurse. I have experienced a lot of pressure every day in that job. Sometimes, I had to cover more patients than usual, in the absence of other staff nurses. To manage my increased workload, I had decided to create a list and priority of care. By organizing and paying attention to detail, I was able to manage things successfully. I also practice yoga, so that I don't feel any stress.
How do you handle the questions asked from the patient's family and friends?
Whenever the friends and family of a patient ask questions to me, I try to answer them with empathy. As a nurse, I have to give them the best information that I can. I try to answer them in a kind way, imagining myself in their position. When I find that I cannot answer all of their questions, I try to set boundaries and prescribe them in a polite way.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparations time is over, now you can start your role play. Don't worry if I stop you when the time is up.
Good morning. My name is Ruben Felix, one of the nurses working in the outpatient department. How may I help you today?
Good morning, nurse. I am here for the follow-up appointment, to check on my injured finger.
All right. For documentation and verification, could you please tell me your full name, please?
Sure, my full name is Mihiraa.
Thank you, Emma. Well, please brief me about the treatment you had.
Okay, I had surgery on my left hand last week, which was bandaged, and were given a splint to wear.
Fine, but for better clarification, can you please tell me how the accident happened?
Oh, yes. It was following an accident with a chainsaw while cutting down trees in my garden.
I am sorry to hear that, Emma. And I would like to know, how have you been managing with the splint?
To be open, nurse, the splint was uncomfortable for me. So, I only wore it for one night and one day.
I understand your feelings, Emma. However, it is very important to wear the splint to prevent further complications.
What is the purpose of wearing the splint?
Your question is sensible. I will explain it to you in detail.
Okay.
The importance of wearing the splint is to support the damaged tissue. The splint also serves as a guide that prevents overstretching of tendons. Therefore, it is very essential to wear a splint for a certain period of time until the damaged tissues and tendon get repaired and regain their functionality.
Certainly, I do not wish to wear it. The splint was very uncomfortable for me. Hence, I do not want to use it again. Also, I do not think it is necessary.
I acknowledge your thoughts, Emma. Why do I insist you wear the splint is that it will help in faster recovery and can avoid further damage to your tendon, as the splint almost covers the damaged tendon and provides the necessary protection. Since you said it was uncomfortable for you, I can offer to have a new one made so that you may be more comfortable.
Nurse, I do not think it is necessary for me. So, I do not want another one. For the tendon damage, I underwent plastic surgery to repair it. Now, you are making me panic and confusing me.
I apologize for the confusion you had. Kindly listen to me. I will explain it clearly to you.
No, I am afraid to believe you, nurse. I wish to see the surgeon.
Your concerns are quite natural, Emma. If I were you, I too would have thought the same. I humbly request you to listen to me patiently.
Okay.
Thank you for your cooperation, Emma. For your better understanding, I will explain the procedure you have undergone.
All right.
From the records, I can find that, in the accident, your finger was almost severed. Thus, a plastic surgery was done to repair the tendon of the left index finger.
Yes, that is what I said.
Your understanding is correct so far. Nevertheless, the tendon may take a few weeks to get repaired by the body and requires attention in order to prevent damage and for complete recovery. That is why the left index finger is dressed and provided with a splint for support.
Oh, I see.
I hope it is clear for you now, Emma.
Yes, I thought the surgery would be enough to clear the damage.
All right. During the recovery period, there are possibilities of getting tendon damage if you do not wear the splint.
Okay, I understand it now.
That's great. As you felt uncomfortable using the current splint, I will order a new one for you, so that you can wear it comfortably during the course of the recovery period.
Okay, fine. That is so kind of you, nurse.
I am glad to help you today. Do I need to address any more concerns for you?
No, nurse. That's fine for me.
Now, Emma, I will make the necessary arrangements for your checkup and splint.
All right. Thank you. And that is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.